Substance abuse and the evolution of dependency are issues that can affect anyone, from suburban mums hooked on sleeping capsules to teenagers swayed by peers to try cannabis. Adolescents and young adults are considered to be particularly vulnerable. This might be because these are critical periods of transition and change, and it's often during these transitional times that individuals begin to experiment with new things and face new life stresses. Knowledge is power. Individuals are also at a higher risk if they're feeling down, have self-esteem issues, carry a family history of drug abuse, or feel like they do not fit in with the world around them. What drugs are commonly abused? Let's take a look. Intoxicants, including alcohol, cannabis, also known as marijuana, methaqualone or mandrax, diacetylmorphine, better known as heroin, flunitrazepam or rohypnol, methylene-deoxymethamphetamine, commonly referred to as ecstasy, O-methylmorphine or codeine, various anti-anxiety agents, lysergic acid diethylamide, also known as LSD, methamphetamine or crystal meth, amphetamine, often called speed, benzoyl methylecgonine, known as cocaine, appetite suppressants, cough mixture, inhalants, and prescription pain or sleeping medicine. Each of these substances can lead to a diagnosis of drug dependency. Prescription pain or sleeping medicine often leads to the diagnosis of drug dependency. This issue is commonly identified when the substance abuser seeks help or when an interested family member encourages an appointment with a general doctor, drug counselor, or psychologist. If you choose to seek help, you can expect to be asked several questions about your substance use and any troubles you might be experiencing. Questions may include whether you've ever tried to or felt that you should quit or cut back, if you experience any shame or feel that you might have a problem, or if you have ever used substances as a way of grappling with life's issues. Many people who have experimented with substances or use them frequently will recognize when infrequent drug use becomes drug abuse and dependency. However, self-denial is really powerful and can blind many individuals to the reality that substances are becoming a problem. Substance abuse and dependency can be recognized by the following signs. Feeling that you need the drug on a steady basis, ensuring you have a continuous supply of the substance, and acting in uncharacteristic ways to use, such as theft of money, lying to family members, or turning aggressive when something stands between you and your next drug-taking opportunity. Other signs include feeling lost when trying to deal with life's issues and stresses without the help from your substance of choice, repeatedly failing attempts at quitting your drug use, developing a tolerance toward the substance, and placing yourself and/or others in danger when under the influence, such as driving while intoxicated or engaging in other hazardous behaviors, including unprotected sex. There's also a decline in quality in relationships, work performance or financial position, frictions with authority, the police or other legal issues, and excusing use with phrases like "everybody does it," "need it to relax," or "it's only sleeping pills / marijuana." The factors in the evolution of drug addiction include genetic elements. Drug abuse as a whole appears to run in families, and studies have shown that dependency has a genetic component. While environmental factors influence whether someone uses substances, misuse and dependency are largely influenced by genetics. Poor coping and self-medication are also significant. Many individuals turn to substance abuse as a way of escaping from unpleasant feelings like depression, stress, or anxiety, and it becomes a method to cope with stress. Others use substances as a form of self-medication. For example, an individual suffering from social anxiety might use drugs to become less inhibited and more outgoing in social situations. Regarding the highs and lows, different substances have different psychological effects and produce different mood states. For instance, cannabis is often used as a relaxant, whereas cocaine is a stimulant drug and is commonly used to induce a state of vigor and euphoria. These sensations are enjoyable and serve as positive reinforcement. People continue to use substances to recapture this enjoyable high. Conversely, what goes up must come down. There comes a point in substance addiction where it takes more and more to achieve these enjoyable highs, and so more substances are ingested. The more drugs that are consumed, the harder the fall afterward. Some individuals enter deeply painful and depressed states, and consuming a lot of drugs is often seen as the only way to alleviate these unpleasant feelings. Societal and cultural factors also play a role. Many youngsters are exposed to the theme of substances at an early age by their parents, siblings, peers, and the media. Those who have had substance misusing parents are more likely to use drugs themselves, as are those whose social peer group promotes the theme of drugs. Additionally, cultural values place different emphasis on the perception of substances.